To begin today's show, I'll be joined by my American Medicine Today radio co-host, Ethan Euchre.
Thanks, Kimberly. We're going to visit Biolucid, a digital health company that is pushing the boundaries of communication and understanding between doctors and patients by blending art, science, and medicine in a way never seen before.
If you've wondered when you'll see a Star Trek science fiction type medicine utilizing futuristic diagnostics, our next segment will showcase where medicine is headed.
Biolucid maintains expert digital artists, 3D animators, interface designers, programmers, and scientific medical specialists to create images that are changing the face of medicine.
We spoke to 4 of their senior staff members who are leading the way in providing better communication, resulting in better care.
Thank you both for allowing us to be here. And what's great is the fact that Biolucid is right in our backyard.
Yeah, we cover things all across the country, different people on the cutting edge of technology, innovators and whatnot. So when I first heard about you folks, I thought we have to go down and see what these guys are up to. So what can you tell us about Biolucid and what you all do?
Yeah, so Biolucid is a technology company focused in the digital health space. And the thing that makes us special and the thing that makes us very focused on what we do is really about making health visual. We believe if we can make a disease state visual from the perspective of sharing this with a physician and a patient, and they can better understand their condition and then act accordingly.
Right, because we all know sometimes when patients are in their, what would you say, like an evaluation or discussion with the doctors,
exactly.
It is hard to internalize what's really going to be happening with them.
Yeah, so we understand that there's limited time that a physician can spend with the patient, so what we want to try to do is make that time as efficient, as effective as possible, and give them the tools to be able to have that conversation.
And what I love about it, Kimberly, and we have seen some of this stuff, you folks showed us around a little bit, which I'm sure we'll show a little bit of that stuff. It's really interesting because if you've ever been a patient who isn't from the medical field, a lot of times you have no idea what the doctor's talking about. So a lot of what you folks and what your technology that you're developing is going to do is give a visual representative so the doctor can show them exactly what's happening. Right?
And what we also found over the journey of the last couple of years is the importance of also personalizing that experience. So showing a condition in a video where it's just looking at the video, it doesn't impact the patient as much, but if we can actually simulate that disease and simulate that condition on the spot and on the fly, similar to their condition, then it has a better impact.
And conditions are often linked, so just because you have diabetes doesn't mean that it doesn't affect your cardiovascular health, etc. So I think part of personalization is being able to really customize according to whatever conditions the patient has.
And it's great because the technology that Biolucid is going to bring to the patients, they're going to be much more informed when they are interactive, and maybe it'll spawn more in-depth questions.
Yeah, you're absolutely right, and patients are becoming more and more empowered to take control over their health situations, but we have to give them the tools to be able to understand that, so that's one of the things we'll be doing. Right, so off of the screen you're actually seeing the human body coming out at you, and we'll show different phases of the human body going back from skin to various elements as you're peeling back actually the layers of the body, so that's what you're seeing over here.
This is some early technology we did just to demonstrate that what we're creating with art can be put on multiple types of technologies and platforms, from holographics to digital pads to PCs.
We're here with Dale Park, Chief Scientific Officer, and Jeff Hazelton, the Chief Technology Officer, both of which are co-founders here at Biolucid. Why don't you go ahead and explain the importance of what Biolucid brings to, well, the public?
If you think about what we do, we take science and technology and art and we combine them together. And the result of that is the creation of a way for people to better understand health. Basically, we're visualizing health, and we're taking what starts with very complex science and medicine, very complex technology, a staff of artists and creative people, and we produce a way for people to just easily understand medicine. Essentially, we're breaking down that barrier that all healthcare practitioners face, which is the language barrier. You have very complex concepts that are hard to communicate, but when you see them, you understand them. To do that is the art that we do, the art and the technology combined with science.
And I know they described Dale as the mad scientist of Biolucid, which I thought was really neat. And Jeff, you yourself, maybe we'll have a shot of the 3D paintings that you have throughout the lobby and the building. It still blows my mind that you can sit down and I would just love to watch the process, you know, of how you put all that together.
How long did it take you to do that? To draw that?
That was, yeah, I
Or
mean,
paint,
probably
rather.
a couple weeks, I guess. You know,
That's
a
it?
Period of, yeah, like, you know, some months, 6 months of, you know, the thing that's in there, and there was a number of other ones that we did.
So you just did a bunch of them. Why don't you sort of describe your own background and what you bring to the technology and how it's going to affect people moving forward?
Really, I think art is what communicates. So good art communicates well, and we're really at that high bar of visual art, visual digital communication. So all of the tools that you would find in, you know, cutting edge Hollywood movies or, you know, AAA video games, those are the things that we take to use to communicate these scientific and medical messages.
I know some of the things that you have shown us today that were actually developed 2, 3, 4 years ago. It's amazing to us, and you guys are like, oh yeah, that's the stuff we were working on a few years ago. Is there anything coming down the pipe that you can talk about?
You know, virtual reality, immersive as you can get, just like the movie industry actually is looking into doing virtual reality in the film industry. You know, we're looking at it as a means to put our own content in development and get our users or our you know, patients really having an impact in, you know, in their own health, you know, feeling it, and also hopefully with the, you know, with the immersion comes better outcomes, because like you guys said, they're understanding this stuff on a much deeper level.
Why do you think that it's taken so long for the healthcare industry as a whole to reach out and grab the technologies that you guys are bringing to the table?
Well, honestly, I don't think it's taken that long. What's really happened is we've always been right at the edge of what's technologically possible, and it's only recently that that possibility is starting to become such mainstream that people can really take advantage of it. And so we're really pushing even harder to bring that out. But at the end of the day, it still comes down to giving a healthcare professional the tools that they need to effectively communicate, like with a patient or someone else. Because that high impact, as he mentioned, that high impact visual is what makes people who are on the receiving end of this understand.
Now, the devices and the technology itself, are they going to be only utilized by hospitals or different institutes, or is it something that a patient can actually bring home with themselves?
Yeah, ultimately, yes. You know, you can think of this as a sequence where you need healthcare professionals to be using this first. And then ultimately it expands from there to where it gets into the hands of just everyday health-conscious consumers.
Or where companies are bringing it to the forefront. For example, a lot of the health provider networks, a lot of the lab companies like Quest and some of the others, they have now mobile apps that they use to say, do you want to look at your labs? Do you want to look at this stuff? You know, this is geared towards the patient, and this helps the patient get information, just like a health provider, health insurance company, something like that, will have patient portals because it's in their best interest.
Well, we certainly hope you have us back when these technologies are actually hitting the market. We'd love to be able to spotlight more in our program.